We knew it was a boy, so we were excited for Everett to have a brother. We decided to name in the hospital, named him Landon. Everything was great. He was in the hospital room with us for both days. They had done some blood work and had discovered that his bilirubin counts were up, so that then landed him a spot in the NICU. They said, a couple days under the lights for him, and we could go home. So that's kind of how it started.
It just ended up turning into a bunch of discharges and readmitting into the hospital. Levels would just keep rising when we came home, and yeah, so it was a hectic first couple weeks in and out of the hospital, not understanding anything, and it finally got to the point where we, I believe you were in the hospital with them, and they were trying to figure out plan of action, and Courtney basically said, we're not going home until we get an answer.
They thought he had some rare blood disorder, so he went through blood transfusions, he went through all the standardized tests. So I think what was more eye-opening or just concerning was no one knew what was going on.
So it was 6 weeks in, and we did the genetic testing, and they did it on both of us as well. And they found Gould syndrome for him, and they did not find any trace of it in either one of us. So what they call is de novo, meaning he's just a new case of Gould syndrome. He's the first. So that was all very confusing to us. I mean, this was all new. We knew nothing about it. We did a little research, or they gave us a small packet on what Gould syndrome was, and you look at some of the numbers, and they say less than 400 at the time had been diagnosed with Gould syndrome.
So it's a syndrome that affects multiple, obviously with it being rare, it affects multiple organs. So, it affects his brain. He has calcifications on his brain, as well as seizures. They call them epileptic spasms when he was littler. It's a mutation in a collagen gene. And so it pretty much was just as simple as a typo in his DNA with everything. And that one small thing affects multiple organs of his body, between his brain, his heart, his kidneys, his head size, his eyes. It just affects different organs differently.
A lot of people have their children sleep in the same room as them. First couple months, Landon is still sleeping in our room. He's 3.5 years old, just for us wanting to have him close to us, and in case anything happened. The daily routine is just so much longer. Like getting ready to go somewhere takes so much longer to make sure we have everything for him ready. We wake up, and before he can even really get fully awake, one of us is rushing downstairs to make his medication bottle. All of his medications go in his morning feeding. So we put 6 or 7 different meds in that bottle, and then make sure we give him the syringes of the other medication while we're getting him ready for school. So one of us always has to be caring for Landon, which is very difficult, because having another child with Everett, it's like he wants to be playing something. He wants me to go outside and throw the ball with him. And I know if I'm doing that and taking my attention away from Landon, then Courtney needs to be on at that point.
As we've been a part of these programs and we've received additional equipment, it is nice because then he can sit in a chair that's more supportive for him, that he can play in, and we have switch toys that he's able to do.
Every child has the milestones they go through as they're growing up, and we learned quickly that Landon's timeline was going to be different than most kids, and than Everett's was.
We call them inchstones.
Inchstones, sorry. Yeah. So
they call them inchstones, and it's because they're it's not about what a typical kid does, or I remember doctors saying, oh, well, can he track for his vision, and it just realize that he's doing things on his own time, and also finding the joy in those little things that he's doing. As far as his first laugh, we got after his brain surgery, and we had it on video, and we're all laughing and crying, and just those kind of moments. Those little things that everyone takes for granted is something that is a huge deal for our family.
For me, at least, when the switch flipped, and it's just like, okay, we're dealing with something very rare here. Doctors don't even know about it. They don't know what to do about it. So, and funny enough, it was immediately after that you said, what are we going to do about this? Like, how are we going to help, and what can we do to help kids, people, adults, families that have Gould syndrome? Because with it being so rare, we knew that the research and the funding was not going to be there. And Courtney, with the heart that she has, that's the first thing she thought of, was how we're going to help out.
Our genetic team was wonderful, but I just felt like I needed to do more. So I just directly reached out to Dr. Gould when I found him and his contact, and he is at UCSF in California. So reached out to him just to say, here's our case. Can we share any information? What do you have going on? And how can we help? For Landon's first birthday is when we did our first fundraiser, and we did, we call it Landon's Lap. So every year for his birthday now, we've just go to a local park, friends and family, and we do a walk. And then we started just sending that money to his lab. I think the connection with Take Part, I want to say I came across Maria on Instagram just because she was another rare mom sharing her story about her daughter Natalie and all the work that they were doing. It was great to see what Take Part was doing for the community, and something that was really, that we were passionate about.
Yeah, and I mean, the funding will go such a long way. Through our little walk that we do every year, there just wasn't possible to get this kind of funds to Dr. Gould and the research he's doing, and just seeing what Dr. Gould presented to them and how he's going to use the funds. It just seems like that money is really going to go a long way to genetic therapy testing and research.
Knowing that something's happening behind the scenes is something to kind of hold on to as well when you're in the midst of hospital stays and trying to figure out, medication changes for seizures and all of that. So it's something to kind of know that it's nice to have things behind the scenes happening, knowing that they can do something with all the symptoms that Landon has. So
there isn't a cure. I don't know if there will be a cure, but there will be these therapies that can help people live their life better and really just kind of ease the symptoms of what's going on, in a kid or a patient with Gould syndrome. So any money, and especially large amounts of money like this, could really go a long way.